You get the slides, Dr. Walks?
I did get the slides. Yes, sir. Good day, everyone, and welcome to Black Health Trust. I'd like to turn it over to our founder, Dr. Randall Maxey. Let's get you unmuted, Dr. Maxey.
Good afternoon, everybody, and thank you for joining us on this beautiful afternoon. I went to a reception last night, and I'm going to be very careful not to be political, but it's for a member of the U.S. House of Representatives, Maxine Waters. And in her excellent speech that she gave to the gathered audience in a wonderful mansion located up in the canyons of California, she spoke of the current politics of the United States. And among the other things, she was saying that people should vote in their interests of people who are interested in their health and their future and their families. And that we should cast our votes along the lines of people that will likely help our communities. One very important thing she said that I had not previously understood is that some of the pundits are requesting that the current president stand aside. If that were to happen, there would be no role for the current vice president. If, on the other hand, he were to resign, or if something were to happen to him medically, the vice president would become the president. But using the word step aside is very strategic in that it cuts out the current vice president from consideration. So that's something to hold in mind. Also, our current speaker, who is planned to speak today, who is Dr. Moloch, who will have another day to come, was severely ill with COVID.
Hmm.
I spoke to one of our main consultants on viruses, and he had just recovered from COVID. I spoke with Dr. Virginia Kane, who was about to become the president of the NMA and is an infectious disease specialist, and she thought we should address what's going on with COVID. Dr. Barbara Davis-Stevens thought we should address it. I'm sure Dr. Walks thinks we should address it because it is not gone. There are problems. So I'd like to review a few things with our panel and talk about some of the things that need to be done. Simon, if you can put up the first slide, I'd appreciate it. Go to the next slide. So there are still continued COVID concerns. It's still with us and here for sure, absolutely. As I mentioned, a number of states have the issue that COVID is increasing. Although I looked at the CDC tracker this morning, and it said that the death rate is 0.8% right now. I don't know what that number is mathematically of 400 million population, but it's still not acceptable. And let's go to the next slide. So, Dr. Walks, you were the chairman of our vaccine committee. Maybe you can just speak a minute about this slide and our other co-moderators can chime in.
Yeah, Dr. Maxey, this slide reads under COVID-19 prevention, vaccination. We certainly recommend COVID-19 vaccination regardless of pregnancy or breastfeeding status. And it's just important that we continue to reach out to our primary care folks, make sure we understand our health status, and make sure that we get good information about vaccination and not just listen to some of the made up reasons. Well, you shouldn't get vaccinated because of this, or you shouldn't get vaccinated because of that. Just make sure that you have good information, current information about your own vaccination recommendations.
Okay, let's go to the next slide. So there are core prevention strategies suggested by the CDC, and they recommend that everybody, all people, use core prevention strategies. And these are important steps that you can take to protect yourself and others. 1, stay up to date with your immunizations. And I understand from Dr. Kane that there is not a new immunization out right now, won't be out for another month or so. But for those who are not vaccinated at all, you should definitely consider getting vaccinated unless there's some severe contraindication for you to do that, not to do that. Also, we want you to practice good hygiene, and that means keeping your hands out of your eyes, mouth, and nose, because that can spread something that could be located on the surface, on your hands, or where you put them. So that's important. So cleanliness is next to godliness. That's extremely important. And also, you should take steps for cleaner air. One of my consultants seemed to get infected just because they were on a plane and somebody coughed. So you want to make sure in a plane, which is a confined space, that you wear your mask and that you consider, hopefully don't be next to somebody who's coughing or has upper respiratory tract infections, but wear your mask and turn your head and be careful. Also, when you may have a respiratory virus of any kind, so you want to prevent it spreading to other people, wear your mask, seek health care promptly, make sure you're tested, make sure it's not COVID or whatever. And not only should you be vaccinated for COVID, but there's respiratory syncytial virus or RSV, there's pneumonia. You should receive, in my opinion, all of the vaccines that are recommended for you. What do you think, Dr. Nabert and Dr. Walks?
Well, as Dr. Walks said previously, make sure you touch. This would be an excellent time to touch base with your primary care provider to assess what your risk factors are and to develop the appropriate strategy for you.
And I'll just add to that, Dr. Maxey, Dr. Nabor-Stevens, and our honored guests. There are certain things that Dr. Nabor-Stevens always talks about that include common sense. I've seen people talk about the fact that the the airplane air is circulated a certain number of times, and so it's very good, and you shouldn't worry. I don't know about anybody else, but to me, it just makes common sense. If I'm sitting right next to a whole bunch of strangers, that I would take some precautions, and it makes sense to wear a mask if you're going to be traveling. It makes sense to practice good hygiene, wash your hands. Don't, if you're walking down the stairs in some public place and you're holding on to the rail, which is a good idea, holding on to the railing or walking up the stairs, don't just do that and then right after put your hands to your face and that kind of thing. So these are all the regular strategies we take to prevent ourselves from whatever may be out there that we don't want to have in our body. So all the vaccinations, all the common sense steps, all of those things are just really important.
Thank you, Dr. Neighbor and Dr. Walks. Let's go to the next slide. Dr. Walks, can you do this one?
Additional prevention strategies you can choose to further protect yourself and others include, and I think there was just entry in the chat, and I think it was Dr. Gibson, of course, who mentioned the KN95 masks. You see people who will just put a little, I don't know what, a homemade mask, a piece of cloth or something. They'll pull up something over their face. That's really not the same as protecting yourself with a proper mask. So as Dr. Gibson put in the chat, the KN95 masks are they're the gold standard for just us regular folks walking around, different from the N95 masks that folks use in healthcare settings. But the KN95 mask is a good option for protecting yourself. Physical distancing. I don't know why people want to just get all up on each other and they don't know each other. I don't understand that. I like to keep my distance from other people. Maybe it's because of the neighborhood I grew up in. I like to have a little bit of a distance. So in case I need to react, I have some space around me. But physical distancing is important, to not be so close to other folks because we don't know where they're from in terms of, are they just coming out of an illness, just coming out of their sick bed? We just don't know. And then testing. Most states still have an opportunity, even though the federal government program to get free test kits has ended a couple of months ago. Most of the states, including Washington, D.C., still have the opportunity for folks to get free test kits. So it's important to understand that testing to see if you have COVID is important. Testing to know that you don't have COVID is also important for a couple of reasons. One of them is just being able to identify whether or not COVID is prevalent in your community. If folks are regularly testing, then folks can regularly know that either there's a low incidence in their community or a high incidence in their community. And information is just good. It's good to know stuff, especially what's going on around you in your community. So masks, physical distancing, testing, all useful.
Dr. Walks, before we move on, just to razz you a little bit as I like to do, did you just declare statehood for Washington, D.C.?
I said states, including Washington, D.C. So I absolutely am happy to declare statehood for Washington, D.C. We need all the things that would bring. We need a couple more senators that would act right, and we need a few electoral college votes. So yes, I'm happy to declare statehood for D.C.
Yeah. Any comment on this slide, Dr. Neighbor and Dr. Gibson? Be welcome to comment. Dr. Neighbor Stephen?
Additional prevention strategies you can choose to further protect yourself and others include mask, physical distancing, and tests. I believe that was the same one from before, isn't it?
Yeah, so do you have any additional comments? I know Dr. Walk already commented, but I thought you might want to expand on it or add as you drive to Memphis.
I'm on my way back to Nashville. What I would suggest that people consider, even though Dr. Walks just gave you pertinent information as to what's available, through your health departments locally. You might also want to consider if your community is experiencing a bump in COVID activity, and you can find that out on the CDC tracker or through your local health department. If your community is experiencing a bump, as many are, and or you are about to travel and are going to be in confined spaces like airplanes, you may want to consider, I'm not saying that you need to hoard it, but you might pick up a box of COVID tests, just so if you think you are potentially having symptoms, that you can jump on it right away. And the reason I bring that up is there are some areas like Florida, where there has been a bump, that it is becoming difficult to find COVID tests in the drugstores and places because they're sold out. So I just pass that on as a word to the wise. Keep an eye on what's going on in your area.
Can you unmute Dr. Gibson if you want to make a comment, Simon?
I think he already did. And thank you. I have to go back to Dr. Maxey's advisory on hygiene. Not only is it a good idea to not allow yourself to touch your face, your eyes, your lips, none of that, but it's a great idea to remember the hand washing. That was one of the primary precautions when at the advent of the COVID pandemic. There was a whole lot of talk, much more talk than there is now. Not many people are mentioning the importance of constant hand washing and making sure that we do not touch surfaces, because people cough, people sneeze, they leave the virus all around them. And even though sometimes we're tempted on our way out of the sanctuary, like earlier today, to shake hands, it's still okay. It's all right. It's okay to bump elbows, or even a fist bump. Friendly fist bump is okay if you're not wearing your vinyl gloves.
And thank you, Doctor, very much. Let's go to the next.
Dr. Maxey, Dr. Lawson has his hand up as well.
Welcome, Dr. Lawson.
Thank you. I just wanted to quickly notice and I'm sure that some of you are well aware there's certain psychological terms such as cognitive dissonance, reaction formation. Basically, when people are put in stressful events, sometimes after the event has passed, they actually develop the opposite reaction and become more risk-taking. We saw this after COVID, so accident rates go up, and we've seen it in other circumstances where folks actually go into more crowded situations. Go just the opposite and say, I'm just not going to wear this mask. So it's important to remember, especially for younger people, that it does not pay. It doesn't to get involved in more risky behavior. Just does not work. So it's good to do what we've done before and try to maintain, but it's also good not to again involved in more risky behavior.
That's a very important and interesting point you bring up, Dr. Lawson. Very good. Let's go to the next slide. Dr. Walsh, would you comment on this one?
I'm happy to read through this one and comment. Dr. Maxey, key times for prevention. All of the prevention strategies described in this guidance can be helpful to reduce risk. They are especially helpful when respiratory viruses are causing a lot of illness in your community. Again, to the point that we made just a few minutes ago, how do you know if there's a lot of illness in your community if you're not paying attention and getting the information? Another key time for prevention, you or the people around you were recently exposed to a respiratory virus and are sick or are recovering. You really need to understand, again, knowledge is power, information is great, what respiratory virus we have, which is why the testing is so important. When are your periods that you are going to be safe to go out? And there is guidance on the CDC site about that. Another key time for prevention, you or the people around you have risk factors for severe illness. This is so important. Many factors can make it more likely for someone to become very sick from a respiratory virus. In addition to this guidance, there are several specific considerations for people with certain risk factors for severe illness. Young children, older adults, people with weakened immune systems, people who are pregnant, and people with disabilities. There's this, to go back to Dr. Lawson's excellent point about folks feeling like, well, COVID's over, I can do whatever now. First of all, that's not true. But second, and maybe even more important, is all of us don't have the same risk. And when you're 30 years old and feeling invincible, but you're exposing someone who might be 70, 75, 80, 85, 90, 95 years old, their immune system may not be the same as yours. So these points about young children, about older adults, people with weakened immune systems, folks who have chronic illnesses, chronic obstructive pulmonary disease, folks that have diabetes. These are the folks that we absolutely have to think about and protect. Even if we are going to be feeling invincible, we should know and make note that other folks are not. Another key time for prevention, you may not be aware of the things that can make others more vulnerable to serious illness. So using the core prevention strategies will provide a degree of protection regardless. If you're unsure about the health condition or risk status of those around you, the most protective option is choosing to use additional prevention strategies like the masking, physical distancing, and testing that we talked about before. This is just, all of this falls under the common sense, realizing that we are not all the same, that we may not have the same result if we are infected with a particular type of illness. These are things that just make sense to do. These are things that a caring person would do, that a caring community would promote.
Dr. Neighbor Stevens, I know in your everyday job, you review lots and lots of cases in church. What do you see relevant to these key things we need to do for prevention and time? I know you review 1 million types of patients every day. What are your thoughts?
The guidance has been developed based on data, and what I see every day is consistent with what has been advised. It is those who have comorbid conditions like chronic obstructive pulmonary disease, severe asthma, emphysema, congestive heart failure, advanced diabetes, the very young, very old, that are having the most difficulty with COVID.
So, okay, that's very, very, very good and very important. This next slide coming up with my visual disability, maybe Dr. Walks, you can look at those states, and can you make a comment on this, or should I pass it?
So Dr. Maxey, when you talk about your visual disability and then you put up something that nobody can really see, I'm not sure that's helpful. I think the main thing about this slide is it shows us that different areas have different prevalences of illness. And so it's not okay for us to travel from coast to coast and not pay attention to what's happening the place that we're going. Because these areas can change, it's not okay to not pay attention to what's happening in your community. So slides like this, information like this, tends to be a snapshot of what's happening now or what's recently happened. And times change, things change, people travel. And so we want to be aware that there are differences from one place to the other, and we should know what's happening around us.
No, that's Neighbor Stevens. I know we talked about the fact that this is a season where a lot of people, self-included, are going to various meetings of their sororities, fraternities, and lodges, and maybe we can comment on some of the things we have to avoid in those places. I know I'm going to New York next month, and for some of the people going to their various meetings, what are some of the things you might suggest that they should look out for, Dr. Neighbor Stevens?
Well, I think the first thing that I know I observe, take note of, is I look around this at the setting that I'm in. Is the room big enough to accommodate the number of people that are in the room and have adequate ventilation? If I feel uncomfortable because I think the room is, as colloquially we might say, the room is too tight, I definitely will have my mask on. I will look to see if there's any way I can mitigate the situation, like sitting next to the door or whatever other opportunities I can identify. So that's the first thing. The second situation when I'm attending meetings that are problematic to me are the eating occasions, when we have the luncheons and the banquets. Again, first of all, I look at the size of the room versus the number of people there. If you're sitting at a table for 8 or 10, we are shoulder to shoulder. We are not adequately spaced. There is no way to eat with a mask on. So you need to be cognizant of the situation you're in and make a decision. Is this place safe enough for me, or do I need to make a change? Now, you all are going to laugh at me. You can laugh at me if you want to. But another place, when attending meetings and stuff, you have social outings and social activities. When you're in the bar, I don't go to a lot of bars. I'm not a bar hop. But the bars generally that I have observed, in the bars that I have gone to, they're usually small spaces. They pack as many people in as they can. So again, it's very hard to drink a drink through a mask. So you need to really think about where you are, what you're doing, and how you can protect yourself. I hope that speaks to what you were thinking about, because it's certainly what I'm going to do.
It does very much. I just thought of something. Does it help to use a straw? Did you hear me?
I doubt it, because I was thinking of my response. I don't think it's going to help a lot, because you still got to breathe. And we know that a lot of transmission is through the nose. So, I mean, it may lessen it, but it certainly is far from eliminating the risk.
I was thinking about putting a hole in your mask for a straw. Maybe I'm being silly.
So Dr. Maxey, maybe I'm being silly, but I know all you fancy highfalutin people go to all these meetings and what have you. But this is prime time for family reunions, which usually necessitates people coming from one area to another, just like those big meetings do. And so all of the things that you and Dr. Neighbor Stevens just talked about with respect to understanding the size of the room, whether it's tight in there, all of those apply. And it just because somebody's family doesn't mean they're not bringing something to the family reunion that that could be unhealthy. And again, you have compression of people across ages that will come to a family reunion as well.
And what that reminds me of, Dr. Walks, is that if you're going to a family reunion and you have a respiratory illness, respect your family and consider not going and exposing them.
Amen.
Let's go to the next slide, Simon. Other things to remember, and we can all comment on this, Dr. Walks and Dr. Neighbor Stevens. Your immune system You have to pay attention to it and make it as strong as possible. I know when we first started the Black Health Trust, we talked a lot about vitamin D and taking the vitamin D to help strengthen your immune system. And we talked about that and supplements such as vitamin C, prenatal vitamins that have all the micronutrients. We talked about good nutrition and making sure that you're eating green vegetables and eating appropriate amounts of protein to keep your strength up, and also daily exercise. You have to keep your body as much in shape as possible. Why don't we just talk on this for a few moments? That's Neighbor Stevens, Dr. Walks.
Well, when you're talking about a healthy diet and the vegetables, and you specifically said the green vegetables, I'd like to remind us that we need to remember the rainbow of vegetables and try to partake of the rainbow as much as possible, because each of the vegetable groups have things that are necessary and desirable, but they are in different quantities in different foods. But if you conscientiously make an effort to partake of the rainbow, you should pretty much hit most of the things that you need.
So, and
Dr. Walk?
I will just add to that. If you think about how our bodies are designed, how we are fearfully and wonderfully made, they're not designed really to sit around. They're designed for us to move around. And so, it's sort of funny. People tell me, and I say this all the time, hey, doc, when I get more time, I'm going to start exercising. Hey, doc, when I retire, I'm going to get in shape. And I just say sometimes to them, but always I say to myself, no, you won't. No, you won't. We do what we do. If we want to be able to exercise, if we want to be able to eat healthy, we have to start now, or we have to continue once we start. There's Dr. Maxey asked me from time to time what we talk about in church. It's interesting. One of the things that we talked about in church today was about having prayer answered, but then not being accountable to anyone. So you sort of say, thank you, Jesus, and run on about your business. And it's hard to stay free from whatever it is you are free from if you're not being grateful and if you're not acknowledging that in your ongoing behavior. The point of all of that is get an accountability partner. Get someone who may ask you from time to time, what did you eat today? Did you drink enough water today? How many steps did you walk today? There's something about having an accountability partner that can help us. When the title of this slide is Other Things to Remember, and maybe we can change the title, Dr. Maxey, to Other Things to Remember, Do, and Report. Remember, do, and report to someone, so that we are consistently behaving in the way that we should, and that we have an accountability partner who we tell what we did and what we're doing.
Something you hear on this slide, and maybe I'm going a little bit too far in the weeds, but that word exercise, we usually think about physical exercise, walking and running and treadmill. But I had an interesting situation yesterday. I was doing some home visits, and I had an older gentleman with me, and he zoned out. He had not eaten breakfast or had enough fluid to drink. And when he zoned out, we didn't quite know what to do. But because he is an engineer and a physician and an expert at all kinds of mathematics, the way I brought him back first until we got some water and juice into him, I asked him to calculate the square root of so-and-so, and he jumped to it. And I'm wondering if we should add to this because it also affects aging too, your continued use of your brain and exercise of the thought process to add to your physical prowess. I'd like just your and Dr. Lawson's and Dr. Neighbor Stevens' thoughts on that.
Dr. Maxey, you are not in the woods at all. It is very important to anything that you want to keep being able to do, you have to do. Last night we had a meeting at church. So as my wife and I are going to pick up someone, we had the GPS on, find where we're going. As we're leaving that person's home, I didn't want to use the GPS because I wanted to make sure I remembered how to get back to where I was, because that's my thing. If I go there once, I can find my way back. And when I stop being able to do that, I will know something is wrong. And when I stop caring about that, I will know something is wrong. So the GPS is wonderful, but use your brain. You know, remember where north and south and east and west are. Try to do things that force you to take in those short-term directions so that you're not just relying on other tools to help you get everything done. Because they're not really all that helpful if you can't find your way around.
Very true. Dr. Lawson, you want to comment?
We have to unmute.
I just want to again note, as the research is continuing to show, that unfortunately, but some of you noticed studies show that many carnivores, like cats and others living in civilized worlds, are becoming less smart and their brains are getting smaller. The reality is that we may be going through the same thing. As Dr. Walks so clearly notes, if you don't use it, you will lose it. And what we're appreciating now is that if you want to keep from getting dementia and other kinds of disorders, you really need to continue to use your brain for your lifetime. Lifetime learning. Don't say, my gosh, I'm such an age, time to stop learning, time to start gaining knowledge. And most importantly, and what I tell folks, and many folks I know in the community who are not in education, who are not medical professionals or anyone else, continue to do things like read and learn about what is happening around you. Continue to be able to function. I'm from the country, and I'm always amazed at some of folks that they end up in a new place or a new area that they are completely dysfunctional. Not because they can't use the brain, but they forgot how to use it. That thing that's on the end of your neck has a purpose. Continue to use it, and especially in terms of things like health maintenance and healthcare.
Dr. Lawson's like Dr. Walks. I have to tease you a little bit too. What do you know about the country? I can't imagine you being in the country.
Me?
I can't imagine you being somewhere
I'm from that vibrant community called West Point, Virginia. We lived in the suburbs of a town that has population 2,000. And when I grew up, when you wanted to get something to eat, you either grew it outside or you went out and shot it. That's how you lived.
By the same token, I'm wondering if cell phones have decreased our mentality. I used to know everybody's phone number. Now I just know call this number and press the button. So I haven't used my brain to remember a number for a while since I got a smartphone. So let's go to one more thing. Oh, while I'm on this mental thing, I had occasion to see a patient yesterday who has a major real estate portfolio. And he's older, in his mid-80s, and he had not done a succession plan for his business. And I'm worried that many of us may not adequately train our siblings or our progeny, our kids, about our assets and businesses. And I was faced with having to declare that this person did not have the cognitive ability to manage his many millions of dollars worth of real estate. And that's something I think that leads to a loss of income and assets for our community if we don't take that type of thing into consideration. I know this is not necessarily relevant to COVID, but it's a thought that we have to keep our cognitive ability and succession planning within our families. And I know that that's very important. And I know Dr. Neighbor-Stevens comes from a fabled family of administrators and pastors and lawyers. I'd like her comment on some of that, and Dr. Walks and Dr. Lawson, before we move to our last slide.
Well, since you're on this topic of planning, and you asked me before about what I see. Unfortunately, I see a lot of people who have not made any plans known to family members or anybody else in terms of what they want done from a medical point of view. And that creates delays in treatment. And it is not a good state to be in. We talk all the time about how you need a patient advocate. I don't believe a Sunday goes by that we don't have some comment about advocating for yourself and having a patient advocate for you. So clearly, if you're so sick that you can't make decisions for yourself, you need somebody in position to be an advocate for you. So I would urge people to, while they are healthy and it's not something that they really would normally think about, I would put it out there that have that conversation with your family members and I guess your attorney if necessary. Get the documentation down so that if you're not able to advocate for yourself, that you have a named advocate and or you specify what your wishes are in terms of your medical treatment.
The other thing that brings to mind, Dr. Neighbor-Stevens, is that many times, and I've seen patients like this for years and years, they have what I call the O sign. They're laying in bed, can't communicate, their mouth is open, and they can't express whether they're having pain or discomfort or anything, and they're 105 years old. But the family wants to just keep them alive, and in that state, they can't eat, they can't drink. So there needs to be this thing done early on, and it's not comfortable addressing a patient in that state where you're obligated as a health professional just to keep them alive. But should you? But we'll have a show on that, unless somebody wants to just comment on that briefly, Dr. Walsh, Dr. Lawson.
Dr. Lawson has his hand up. I don't know if we can get him unmuted again.
Yeah, I just wanted to note, you're talking about the elderly. I think the tragedy for many of us is seeing this happening for many of our young people. There are stories after stories after stories about multimillionaire athletes going out and losing literally all their wealth, not because they're demented, although some of them may be, but simply because no one ever bothered to tell them basic facts about economics. Folks are talking about the importance of reclaiming some of our wealth that we've lost during slavery. Unfortunately, a lot of it is lost, not because folks in some malicious way go out and take the land of African Americans, but because folks didn't do some of the more basic things, like seeing whether or not the land itself has a deed or a property or anything. So there are a number of ways in terms of our communities, and I think part of it is that we are socialized to think that way, that somehow you shouldn't put your focus in terms of economics, that we could think of more higher spiritual things, that results in us making lousy decisions, not only about healthcare, but also about land management and wealth. Let's not wait till folks begin to develop dementia or organic brain disease. let's wait and see some basic things, like whether or not some of our folks who for the first time getting property that's worth something. Some of us live in communities in which inexpensive land is now worth millions. Get the kind of, if they don't have the technical support, get the technical support to be able to make decisions about our communities. Many of us are sitting on wealth in some major cities, but unfortunately have not done the basics in terms of saying, but guess what? I'm not going to live forever, much less I'm not going to have a brain functioning forever. To take the steps necessary to preserve our communities and to have interdimensional wealth. I just want to make the other key point, and that is the median income for African Americans, and while it's about maybe 60% of white folks, is only 1/10 in terms of family wealth. Not and it's mainly because we have not taken steps to ensure generational wealth.
Well, thank you so much. Let's go to the last slide. So ARBs, those are high blood pressure medicines called angiotensin receptor blocking drug. And there was a study done at the NIH and a number of other places that found that when you take some of these blood pressure medicines, or if they're given to you on a certain theory that they're going to be good for you, it's not true. But it is true that if you are already on these antihypertensive agents, that even if you get COVID, you should continue to take those drugs when you're sick or when you're in a hospital, unless you have drops in your blood pressure. So those of you who see patients, make sure you don't just rush to put somebody new on the medication or take them off without knowing what the issues are with the maintenance of blood pressure. And some of these studies are ongoing, but I see a lot of people on these ARBs and ACE inhibitors, and they get sick, so it is a concern. Why don't we move to final comments with Dr. Walks and Dr. Nabors-Stevens? We're at the top of the hour almost.
So thank you, Dr. Maxey. This is an important discussion. A lot of what we covered were things that we have covered before, and the reason it continues to be important is because we continue to have a death rate from COVID. We continue to have COVID infections spiking in certain communities. And so it's, we need to reinforce things when folks are not, or when we are not adhering to the things that are important for us to do. So I just want to encourage all of us, don't get weary in well-doing. Don't get tired of being the only one with your mask on. Don't get tired of being the only one that's washing your hands. Don't get tired of being the only one that is paying attention to COVID. Act in the best interest of yourself, your family, and your community.
Thank you, Dr. Walks. Dr. Nabors-Stevens.
I want to go back to something that we talked about a lot when in the height of the pandemic, which is related to what Dr. Walks was just talking about, and that is, unless there's a miracle, and miracles do happen, we will be living with COVID going forward. And by the nature of it and other viruses and other pathogens in general, even bacterial, there are times when there can be an increase in the disease burden triggered by these agents. We will be continuing to have conversations about COVID. Don't get blasé about the subject of COVID, pneumonia, RSV, or even bubonic plague, because we now are seeing at least 2 cases. I saw Friday, I'm not sure what happened yesterday, but there were at least 2 cases that have been found in the United States. bubonic plague, and this is something that we've been hearing about since the Dark Ages. So please, please follow the advice that we are giving and that others are giving. Pay attention to the notices that come out from the CDC. And you know what I'm going to close with? Use your common sense.
Is measles still an issue, Dr. Neighbor-Stevens?
I'm sorry, what did you say?
Is measles still an issue?
Absolutely. There's a lot of talk in the pediatric community right now because of the raging numbers, relatively speaking, of measles now when we almost had it eradicated, all which goes back.
Thank everybody for
Yeah.
Thanks everybody for joining us on this Sunday afternoon. Be safe, protect yourself, protect your family, and do what you can to prevent these illnesses from coming. Stay healthy. Have a great Sunday. Thank you, Simon, for your help.
Good day, everyone.